This is a story of how a father conducted resuscitation to his newborn baby without hospital support. The baby was due in 6 days. At least, that's what the doctors said. But on a freezing night, at exactly 9:17 p.m., Sarah felt a sharp pain that stopped her in her tracks. By midnight, she would be fighting for her life. Her husband would be forced to deliver a baby he had never even held before.
What happened?
A baby was born without a cry, and he had no choice but to save his wife and newborn using the knowledge gained from an
We're only
online
20 minutes
video
from
he
the hospital.
watched.
You'll be okay.
What happened that night would become a story nobody in the town would ever forget.
What was that?
Hold on!
The first contraction hit hard. The second hit harder. Then suddenly, the engine died. One moment they were moving. The next, they were stranded in the middle of nowhere. No signal.
No! Somebody help!
No traffic. No ambulance. And Sarah's contractions were now less than 3 minutes apart. The baby wasn't waiting. Snow fell on their dresses as they stumbled through the darkness.
I think I found help!
Sarah could barely walk. Every step felt impossible. Then they saw it. A faint light glowing through the storm. A small farmhouse sitting alone on a lonely hill. Neither of them knew who lived there. But they had no choice. The next knock on that door would change their fate. The blizzard had knocked out the power hours ago, and the nearest road was buried under 3 feet of snow. Inside the small cabin, lit only by a crackling fire,
The baby is on its way. What do we do? How do we get to the hospital?
Don't worry, you'll be okay. I have to save you and our baby.
I am scared.
a baby arrived in a sudden, silent rush. There was no cry, not even a whimper. In that terrifying stillness, with no doctor and no chance of help arriving, all that stood between a fragile new life and the cold was what the father had learned from a video he once watched. He remembered the simple, vital steps. The immediate assessment.
Please, I
do
need
we
an
have a
ambulance.
problem?
I have an emergency.
When a baby is born, you're listening for that cry. It's a powerful, reassuring sound that tells you their lungs have kicked into gear. If you don't hear it, you have to act fast. That first minute after birth is so crucial that medical providers call it the golden minute. What happens in these 60 seconds can determine the course of a newborn's life. There was no cry. He looked at the baby's chest. Is it rising and falling? He wasn't fooled by faint gasps. That's a sign of a major problem. He was looking for strong, regular breathing. Second, he looked at the muscle tone. A healthy newborn is active. Their arms and legs are flexed and they're probably wiggling. A baby who's in trouble will be limp, like a rag doll. Their arms and legs might just hang loosely. That's a huge red flag. Third, he looked at the color. Most bobbies are a bit blue right at birth, but they should pink up quickly as they start breathing oxygen. A baby that stays blue or pale isn't getting enough air. Step 1, the golden minute, warmth and stimulation. The first thing he did was to get him warm and get him stimulated. A newborn loses heat incredibly fast, and being cold makes it much harder for them to start breathing. It's time to act decisively. He grabbed a clean, dry towel, put the baby on a dry surface out of any drafts. Now he dried the baby off and did it vigorously. He started with his head, then his body, arms, and legs. This one simple action does 2 critical things at once. First, it stops heat loss. A wet baby is a cold baby, and a cold baby will have to work much harder to breathe. By drying them, you're giving them a fighting chance. As he dried him, he rubs his back and gives the soles of his feet a few good flicks. You aren't trying to be rough, but you have to be firm. Your goal is to startle their system into action. He did this for about 30 seconds. In many cases, this is all you'll need to do. You'll see the baby gasp, then cry. Their color will start to improve from blue to pink, and you'll feel their body go from limp to active. If that happens, you did it. Keep them warm, wrapped in dry blankets, and keep a very close eye on them. But what if 30 seconds of this isn't enough? The baby is still silent, still limp, and still blue. He didn't keep rubbing. It's time to move to the next step because the clock is still ticking. Step 2, securing the airway. Clear the path for breath. If warmth and stimulation didn't work, the problem is more serious. Air isn't getting into the baby's lungs. Next, he makes sure there's a clear path for it to travel. This is what we call opening the airway. Think of the baby's airway as a tiny, flexible straw. If it's bent, nothing gets through. You have to get their head in the right position. He lays the baby on his back on a firm, flat surface. The floor is better than a soft bed. You need to get the head into what's called the sniffing position. Imagine the baby is trying to sniff a flower that's floating just above them. This means the head is neutral, not tilted way back or flopped way forward. A slight chin-up tilt is all it takes. A small, rolled-up towel placed under the baby's shoulders can help get this position just right. This lifts the chest a bit and aligns the airway perfectly. Be careful not to tilt the head too far back, as that can actually pinch the airway shut. With the head in position, he checks if anything's blocking the way. Sometimes a baby has mucus or fluid in their mouth or nose. If you see a blockage, you need to clear it. If you have a bulb syringe, squeeze the bulb before you put it in. Then he puts the tip in the baby's mouth, toward the cheek, and release the bulb to suction. After the mouth, he does the nostrils. Always go mouth before nose. Positioning the head and clearing obstructions, that's it. You've unkinked the straw and cleared the path. Now you're ready for the single most important step, giving breaths. Step 3, giving breaths, the spark of life. This is the moment where you give the spark of life. If a newborn isn't breathing, it's usually because their lungs haven't made the switch from the fluid-filled world of the womb. Breathing for the baby, ventilation, is the single most important step in saving their life. In a hospital, they'd use a special mask and bag. He didn't have that. You have your own lungs. You're going to perform mouth-to-mouth and nose resuscitation. First, he double-checks that the baby's head is still in that neutral, sniffing position. He takes a normal breath himself, not a giant, deep one. A newborn's lungs are tiny, and you could hurt them with too much air. Now he places his mouth over the baby's mouth and nose, creating a good seal. He gives a gentle puff of air, just enough to make the baby's chest rise. That is your most important cue. He watches the chest. When you give a breath, you should see it gently rise, just like with a normal breath. Then pull your mouth away and watch the chest fall. The rhythm is everything. Give one breath, then say to yourself, breathe, 2, 3, and give another. Your goal is about 40 to 60 breaths per minute, and that simple rhythm will get you very close. What if the chest doesn't rise? He didn't panic. Air isn't getting in. First, he repositions the head. The airway might have shifted. He makes sure he has a good seal with his mouth. He tries again. If the chest still doesn't rise, there might be a blockage you couldn't see. He quickly opens the baby's mouth, and if he sees anything, he turns the baby's head to the side and sweep it out with his finger. Then, repositions and try again. He keeps giving breaths for 30 seconds. After 30 seconds of breaths, he stops and looks for signs of life. The most important sign is the heart rate. Without a stethoscope, you can check it by feeling for a pulse at the base of the umbilical cord, right where it meets the belly. You can also put your fingers on the left side of the baby's chest to feel for a heartbeat. You're hopping for a heart rate above 100 beats per minute. If it's fast and strong, that's a fantastic sign. Also, he looks at his breathing. Is the baby trying to breathe on his own? Is his color getting better, going from blue to pink? Is his muscle tone improving? If the answer is yes, if the heart rate is over 100, the baby is starting to breathe, and his color looks good, you've done it. You can stop giving breaths but keep rubbing their back to provide stimulation. He keeps him warm and watch him closely. But what if they aren't getting better? What if the heart rate is still dangerously slow, below 60 beats per minute, and they're still not breathing? If your breaths are making the chest rise, then keep giving breaths. Good ventilation is the top priority. If, and only if, the heart rate stays below 60 beats per minute despite 30 seconds of effective breaths that make the chest rise, you should consider adding chest compressions. This is a more advanced step, and it's rarely needed if ventilation is done right. For a layperson, breathing is the main event. But if you have to, place 2 fingers on the center of the baby's chest, just below the nipple line. Press down about 1/3 of the depth of the chest. The rhythm is 3 compressions for every 1 breath. It sounds like this: 1 and 2 and 3 and breathe. But let me say it again. In a newborn, breathing problems are almost always the cause, and giving breaths is the cure. Don't let anything distract you from giving good, effective breath. The knowledge you've just gained is powerful, but it's a starting point. The goal isn't to replace professional medical care, but to be the bridge until it gets there. The very first step, before you do anything else, should always be to call for emergency help if that's an option. These techniques are lifesavers, but they're stopgaps. To really build your confidence, I strongly encourage you to look into hands-on courses from organizations like the American Heart Association and the American Academy of Pediatrics, especially programs like Helping Bobbies Breathe. There's no substitute for real practice. Please share this information. You never know who might need it, and you never know when it might be the key to saving a life. Subscribe for more content that empowers you with skills that matter.